Congratulations! Your skin cancer has been cured and you are on your way to a great recovery. We will review with you how to take care of your wound, and we will also give you an important FAQ sheet to take with you. Please keep this sheet and read it over, as it will address most, if not all, of the questions you may have at home. There are a few points we want to emphasize today. Our number one concern for you when you get home is bleeding in the first 24 hours. For that reason, we do not want you to engage in any strenuous activity or exercise for at least 24 hours. Avoid bending over or straining. And no alcohol tonight either. It makes you bleed. Take it easy for the rest of the day at the very least. Get your feet up and rest. Even if you don't feel exhausted, your body is exhausted and needs rest. Your post-operative discomfort will peak about 6 hours from now. For that reason, we want you to take a rotation of Tylenol and Advil every 2 to 4 hours. Even if these pain medications have not helped you in the past, they are well studied as being equal, if not superior, to most prescription pain medications for this type of surgical pain. As with any surgical procedure, there is a risk, albeit low, of a skin infection. When infections do occur, they typically present in the first 48 hours. Infections are associated with burning, intolerable pain, lots of thick, runny discharge, and bad odor. Many patients will get concerned and misdiagnose themselves with infection. All healthy wounds have a pink rim around them as they heal. All open wounds will make a yellow, stringy material called fibrin. This is a normal healing protein and is not pus. A pink wound with a yellow, stringy discharge, although not lovely, is not infected. Last, I would like to talk to you about the cosmetics of your healing. It is important, first and foremost, to remember that you had a cancer and it required surgical intervention. We strive to preserve your natural beauty and appearance, and every nuance will be utilized to give you an excellent aesthetic outcome. But it is not realistic to expect a complete perfection after cancer surgery. For most of you, our goal is to get you to a point where no one but you and your surgeon can see your scar. For others with more catastrophic cancers, our goal will be preservation of function first and foremost, with aesthetics taking a back seat. Regardless, be patient. You will continue to improve and your scar will continue to settle and fade away for the next 12 to 18 months. Don't worry if you don't look great 2 weeks from now. The scar will fade with each passing day. Today we have decided to let your wound heal in on its own. A pressure bandage has been placed onto your wound in an attempt to prevent post-operative bleeding. Please keep this bandage in place for a minimum of 24 hours and then simply remove it. After 24 hours, it is important that you wash the wound each day with tap water, either in the shower or sink. Gently clean the wound with a wet Q-tip and remove any loose scabbed material. It is essential that you coat the wound in a greasy ointment after each cleaning and cover the wound and ointment with a non-stick gauze, like a Band-Aid. We will provide a list of appropriate ointments. This greasy ointment with a covered bandage will keep the wound moist and promote scab prevention. Scabs slow down healing. A moist wound will not dry out and will not form a scab. It will fill in quickly and overall look better when it's done healing. Once you see skin has grown over your wound and you are no longer seeing discharge on your bandage, then you can stop bandaging the wound. The length of time this will take depends on the size and location of your wound. Wounds on the leg or foot, as well as wide wounds, take a few weeks longer to heal than others. In the unlikely event that you have bleeding this evening, please apply direct and firm pressure to the bandage overlying your wound. Direct and consistent pressure must be held for 30 minutes. No peeking or checking. After direct, strong pressure for 30 minutes, almost all wounds stop bleeding. Occasionally, you may need to wrap the surgical area with an ACE bandage in order to apply direct pressure. ACE wraps or other elastic type wraps are very helpful. In the exceptionally rare situation where bleeding cannot be stopped using these pressure methods, it may be necessary to go to a local emergency room. But only seek emergency care after attempting at least 30 to 60 minutes of direct pressure. A slight drip or discharge from the wound is not cause for concern and can be cleaned and ignored. I hope that your experience today exceeded your expectations. I know it has been a long day, but take solace in the fact that your cancer is cured and you are now on your way to healing and getting back to all of your normal activities. Many of you have chosen to travel from all over the Southeast to have your surgery performed here today. please drive safely on your return trip home and get some rest. For those of you with shorter Greenville-based journeys ahead of you, please be safe as well, and I hope to bump into you sometime in the future around town.